So, Dr. Rolle, appreciate the time. Obviously, I wanted to get your thoughts on what you are seeing in the front lines going into work each and every day at a hospital.
Well, our hospital, Mass General, has been completely transformed. The hallways are bare now because visitors aren't able to be there. Our elective surgeries, as neurosurgeons, they're either being canceled or postponed at this moment. You have to have a mask on. Every employee, staff, food, transport, maintenance, whatever, needs to have a mask on. Hand sanitizers are everywhere. There's a clinic within a clinic, the surge clinic of people who are manning this area in the hospital that's managing COVID-19 patients who are coming off the street, getting tested or having symptoms similar to COVID-19. So it's a very hectic time, and it's much different now than it was just a month or two ago.
As a neurosurgeon, how are you involved, if at all, with the patients that are coming in with COVID-19?
Well, we have patients on our neurosurgical service who have symptoms that are very similar to COVID-19, so we have to get them tested. We have to consult our infectious disease teams here at Mass General, which are amazing, biothreats, get the right tests and scans and lab results to make sure that we can rule them out. Even for surgeries today, for instance, we tested our patients before the case, and then we had a certain protocol. When we intubated the patients, people had to step out unless they had a special N95 mask. So that has changed our lifestyle in that respect. And then the surge clinic, as I mentioned, has recruited neurosurgeons, neurosurgery nurse practitioners, physician assistants, even our attendings and secretary to man this clinic that's there to help patients who are coming off the street with these symptoms. So even though it's not directly connected to neurosurgery, we're still a part of the greater family of Mass General Hospital, and we all want to do our part to help fight this infectious disease.
When you went through med school and climbed the ladder to being a doctor, could you ever have imagined something like this overtaking our country, overtaking the world?
I could not, absolutely not. I thought at first when I started reading the stories about, coronavirus, I said, well, I've heard of this before, but it wasn't certainly one of the top infectious disease or viruses that I studied in medical school as being, one that could wipe out communities and could really change the dimensions and the dynamics of societies in general. I mean, it's really put a halt to daily life in multiple countries, including this one, and my home country, the Bahamas, same thing. So no, I could not have expected it. I don't think we were prepared for it. But the fact that it's here now, the fact that we know we're getting more information on who it affects, how long it stays, what are the best methodologies to sort of help, which is social distancing, staying at home, staying away from large crowds, all of these things, I think this all helps. And the more information we know, the better we're equipped to deal with it, face it, manage it, and hopefully prevent it from happening again in the future.
Well, I'm a sports guy. You have a sports background. You know the passion for sports around the world. And I think so many of us are having a hard time coming to grips with this lack of engagement with something that we love so much. Give me your thoughts as a doctor, but also someone who understands the passion of fans about what we should expect moving forward in terms of a timeline. If you had to predict, when are we going to see people going to stadiums again here in the United States?
I'd say it'd be a longer time than people may think. I know we want sports. Sports obviously has shaped and defined my life being a former football player. I played it my whole life. I still connected to it now. But I think that it takes some time to get the epidemiologists, the scientists, the wonderful, brilliant minds of our women and men in the front lines to fix this issue, to find solutions, to find the ways to answer the problems that we're having today, to keep safe our most vulnerable populations, a subset of our culture that has been devastatingly hit by this disease, and the families connected to those people who are patients affected by COVID-19. So we have to take a step back and realize that the premium and the priority in this country needs to be the health of our country and the health of our economy and the health of our healthcare system, not so much the health of our convenience and going to sporting events. That will come. And when it does, we'll come back in a big way like we always do. But for right now, we just need to pump the brakes, slow down, and say, right now, there's other things that are a little bit more important.
Can you put yourself in a locker room or a dugout, and as an athlete coming back to a situation that's so uncertain, what do you think the athletes are going to be dealing with mentally, understanding that they're in such close proximity to each other on a regular basis?
Yeah, you're absolutely right. The communal settings of sports, from locker rooms to sharing hotel rooms to meeting rooms, to the weight room, to the training room, all these things. You're close knit. You're close to these guys and girls, and it could be a nidus for infection. It could spread from one person to another. And as we've seen, like players like Rudy Gobert from the NBA, asymptomatic, healthy guy, young, strong, vibrant, got his whole life ahead of him, and he's comes down with COVID-19, and he was able to spread it to Donovan Mitchell, his teammate, and it just continues to pass, and it'll pass like that if we don't get out in front of it, slow down and flatten this curve, and really just again address our main issue, which is fighting this coronavirus, making sure we protect our players, making sure we protect our fans, and doing the best we can, because that's what we want. We want safe sports to happen again. We want to do it in the right way, in the right timeline.
What's been the most inspiring thing that you have seen during this time?
The most inspiring thing that I've seen, being a former athlete, is seeing people come together as a team. When I was at Florida State University, or even with the Tennessee Titans, we took guys from all over the world, all over the country, different backgrounds, different religious backgrounds, different interests, different cultures, and we all had to get on the field to move towards a collective goal. And I'm seeing that now. Multidisciplinary approach, interdepartmental approach towards fighting COVID-19. People in the hospital, people outside the hospital. You have families sending in cupcakes and pizza to all the healthcare workers and nurses because they're so appreciative of the work that's being done. It's really showing the strength and the fabric of this country and the people of this country. And if we keep that going, keep that momentum going, I'm optimistic that we can get over this.